Dear attendees, a very warm welcome to this session. My name is Nigel and I will be the MC for this session. This session is titled Learn and Explore, and we will have different professional representatives share with us about their respective disciplines. We have Amanda, a radiographer from Changi General Hospital. We have Dian Maisara Sulaiman, a social worker from Montfort Care, Lee Xiaoyun, a senior staff nurse from Ng Peng Fong General Hospital, and Vivian Tu, a pharmacist from Woodlands Health. After the speakers share, we will have a Q&A where they will answer questions from the floor. Some housekeeping announcements. In the event screen, you will be able to access the Q&A function. You may type your questions for the speakers there. Do note that in the interest of time, we shall focus on the top voted questions. Should your question be unanswered, you may head on to the Q&A and event feed to ask them, or you may also drop us an email at talent@mohh.com.sg. In case you missed it, we are currently holding a leaderboard contest, and you can check out the game section to participate in our quizzes and games to win attractive prizes. A polite reminder that although we have a contest going on, do not spam questions and do not ask duplicate questions. This is for the benefit of the event participants. Without further delay, I would like to invite Amanda to start off the sharing. Amanda, please.
Hi, sorry, I just realized I was muted. Thanks, Nigel, again. I'm a radiographer at Changi General Hospital, and I graduated from Monash University in Melbourne, Australia in 2018, and I've been working in Singapore ever since. So today I'll be sharing with you some of the things that I do in my daily work. So let's get straight into it. So what is DR? It's the visualization of bones, muscles, soft tissues like maybe your heart, your stomach, all sorts of region of the body that will help the doctors figure out what's going on while you're in pain. And radiographers are the ones who provide those diagnostic images. So we are the ones operating the equipments. Some of them are a lot heavier, some of them it looks like the donut shape that you'll be familiar with if you're watching any medical dramas. And so we use different modalities to go about looking inside the human body. And so all radiographers start off with doing x-rays. And then as they further on in their career, they will start to specialize in advanced modalities, as we call it, like CT, MRI, and ultrasound scan as well. So the next slide, I'm going to be showing some images of the different modalities. Some of it might be quite traumatic, and if you're a bit afraid of gory things, you might want to just turn away and just listen to me talking. So this picture is of some finger x-rays that I took. The thing is, these are just the fingers. The patient actually came in with a saw that had amputated off their fingers. So it was an ice bag that I had to take out to x-ray, and then the rest of their hand came along with their persons afterwards. Fortunately for them, we were able to operate on it and attach the fingers again. So that was a good outcome for the patient. Next, we've got some operating theater images. So we as radiographers, we are in the operating theater as well, helping the surgeons decide if their metallic implant is going in the correct position. And so these images show a patient with a hip fracture, and then we've gone in to put some metallic implants in there with tons of screws. So next we've got an ultrasound image, and it's not showing much. And that's the thing. So there's not much blood flow going through the artery of this patient's scan. And because of that, the patient then went on to do an angiography where it did show lack of blood flow. And so they've gone into that artery to put a straw-like structure. So in medical term, we call it a stent, and that will help to keep the artery open and patent so that blood flow can continue to go to the lower limb of the patient. Next, we've got some CT images, and this is where you're seeing a cross-section of a patient. So imagine if you were to cut through a patient's abdominal region, this is what you would see. Unfortunately for this patient, they had quite a big tumor in their liver. And I can't remember the outcome of it, but I don't think it was good. And lastly, I've got an MRI image as well. So this is an MRI image of the patient's neck. This patient had sustained a very bad accident. And what we're seeing is that the spine isn't connected properly anymore. If anything, it has shifted. So one is in front and one is at the back. I don't think the patient was able to walk again afterwards. So you can see all these images. So I like to coin myself as the eyes of the doctors sometimes, because without all these images, the doctors wouldn't be able to tell what's happening inside the patient and why they're hurting so much. So now I'll move on to some misconceptions that we have in radiography. So the big one that always comes up is a question about radiation, whether I'm getting too much radiation to myself. And the next one is that we work office hours. So in terms of radiation dose, I'm actually not too concerned because, so this is a picture of one of the X-ray rooms in Changi General Hospital. And if you can see through this window here, you can see the X-ray machines in there. And I'm standing outside the room. So this window here, these walls and the door, they all have lead lining them. So the lead is a very good element to help with filtering out the radiation dose. So whenever we take an exposure, we will step outside of the room, make sure the door is closed, and then we stand in front of the console to take the image, and then it will show up on the screen right here. On top of that, I've got this that I carry on my persons at all time. It's called a TLD, or a dosimeter for short. So this one will monitor how much radiation dose that I'm getting. And so far, I don't think I've heard of anyone who has exceeded the allowed range of radiation dose. So all these things are in place to help keep us safe. So I find that my job is actually pretty safe. So next, in terms of office hours, there's a misconception, or rather people get shocked when they hear I'm doing shift work. So these are the sort of shift patterns that I do. And you imagine that if a patient or if there was a car accident victim in the middle of the night coming into our hospital, we have to make sure that we get the right imaging done to figure out what's happened within them, whether there's any serious fractures, breaks in their body. So we are present in the accident and emergency department, helping with imaging at all times of the day, as well as within the hospital as well for our sickest patients in ICU and high dependency. With that being said, though, sometimes we still do office hours, and also depending on the different types of modality that you've chosen. So if you're in ultrasound or MRI, you're doing more office hours job. And then if you're in X-ray or CT scans, then you might be doing shift work. And I like this good mix, actually. It's been pretty, I guess I get to plan my time quite effectively around it. So why did I choose DR? For a long time, I struggled to find what the term was, but I knew that I wanted to help people. And I finally realized that over time, my purpose is to serve people who need help the most. And combining that with my hobby in photography, and that's something that I've always loved since secondary school, I was able to decide on radiography as a career. And it's been 7+ years since I first started studying radiography, and I've loved every bit of it. So I was asked to share what my typical workday is like as a DR. I actually laughed when I saw this because I feel like there's nothing typical about my day at all. The kinds of cases that I see vary so much. There will never be a same day for me. So I can go from seeing, let's say, this chest X-ray of a patient. This part of their lung is actually normal, but on this other part here, there is a very large tumor. So it's lung cancer within the patient. And maybe the next patient I come across could be a COVID patient with a lot of white in their lungs. This means that there's a lot of infection, pneumonia happening. Of course, on top of that, then we've got the fractures that we see in patients, maybe scoliosis of a patient's spine. So a patient's spine should be straight, but this is curved. And other fractures as well that go on into the operating theater to get fixed. And we image those metallic implants as well. So I love that there's never a day in my work life that is the same. There's tons of challenges, which I really love. So what I've found to be an essential skill for a DR is that you need to be quite adaptable in your techniques. You can expect a patient to come in walking or in a wheelchair, but the next moment they're actually presenting to you in a whole trolley bed. And so you need to suddenly adjust your technique in order to get the right images, the diagnostic ones for the patients. On top of that, we need to be highly communicative. We have to be effective communicators, not just with our patients, reassuring them if they're in pain, but also to communicate effectively with other doctors, nurses, allied health to ensure that the patient receives the best care possible in their journey. So one word of advice or a suggestion I would have is to actually email in to any hospital's HR, and they can help you get a job shadowing opportunity. So that's what I did, and I got to see for myself, that radiography was really the career for me. And so I've got this quote here from Professor Margaret Gardner, and I remember her wishing all of us students an uncomfortable experience because it will be another learning opportunity. So embarking on this new journey in the next chapter of your life is going to be uncomfortable, but trust me, it will be filled with tons of learning chances as well. So just a bit of promotion. If you're interested in becoming an allied health professional with Singh Health, just got some information for you. So Singh Health is the largest public healthcare cluster in Singapore, and we have about 11 institutions primarily taking care of the eastern part of Singapore. So we've got over 40 clinical specialties, and we can deliver quite comprehensive and multidisciplinary care through all our integrated network of acute tertiary hospitals, specialty centers, polyclinics, and so on. And so even though our institutions may span from primary acute care to secondary or quaternary care, we always try to make sure that patients are at the heart of all we do. And we want to ensure that patients remain supported as they journey from one care setting to another. So if you would like to pursue an allied health career with Singh Health, you can either take up a healthcare scholarship, which our MOH Holdings colleagues will share more about later on, or our cluster sponsorship. So I personally took up the MOH Holdings healthcare scholarships, but I'd like to share more about the cluster sponsorships now. So institutions offer sponsorships to anyone who would like to be a nurse or allied health professional, and it really gives you a head start in your career. Gives you a sponsorship with your gives you a monthly allowance with this sponsorship, and on top of that, all those small miscellaneous fees that comes with studying as well, it's covered by Singh Health. And of course, depending on the number of years that you are awarded this sponsorship, whether it's like a 3 years diploma or a 4 years honors degree, then the bond period will also change accordingly. If you would like to have more information about this, you can email scholarship@singhhealth.com.sg to find out more. So yeah, that's the end of my sharing. I hope you learned something from it. Thank you everyone for listening. If you would like to contact or connect with me, please feel free to do so at any of these social media channels. Thank you. I will now pass the time over to Dian Maisara Sulaiman, a social worker at Montfort Care.
Hi, thanks, Amanda. Okay, I'm just going to share my screen. All right. Okay, hope you guys can see my screen. Yeah, just going to check a little bit. Okay, yeah. Thank you so much. Thank you guys for joining us this morning. I understand it's a Saturday and I hope you're enjoying your Saturday so far. So my name is Dian. I'm a social worker with Montfort Care. So basically Montfort Care is a network of programs and is committed to improving the lives of individuals, families and communities facing transitional challenges. We're a group of social workers really committed to delivering community social services to empower lives and to strengthen the community. I'll talk a little bit more about what Montfort Care does in the next few slides before we venture into what social work it really is. So I personally love Montfort Care's values. One of them is dare to be different. So we are encouraged to challenge the norm and to inspire others through our actions. Second, a value that we have is strongness. And it's a very unique value to have in a social service organization because we think that it means like, oh, just work and no rest kind of thing. But really, it really alludes to the tenacity to overcome limitations and the drive to make things happen. So it's not that we don't take breaks, but we have the tenacity to overcome any other limitation or challenges that we face. And also the third value that we hold really closely to our hearts is teamwork. So teamwork not only within our own teams, but teamwork within the whole community, because we believe in continuing the care for our families, our elderly, our children that we serve in the community. We need to have good teamwork with all the other partners that we see in the community. So some of the programs and services that we have family service centers. So our family service centers serve the needs of the family, basically residing in the community within our service boundaries. We believe that we have to work with the formal and community agencies as well. We also have elder care services. Good Life is a wellness program that promotes and improves the overall well-being of seniors. The program now is available at Bedok, Kaki Bukit, Kereta Ayer, Marine Drive, Marine Terrace, Telok Blangah, Yishun, and Toa Payoh. And from Good Life, we have different programs as well, like Good Life Makan and Good Life Home Bathing. So Good Life Makan is our community kitchen located at Marine Parade, and is really to serve the vulnerable seniors in the community. And Good Life Home Bathing is an island-wide home bathing service for bedbound seniors, providing them with dignity and comfort through baths in their home. Some specialized programs that we have, like Big Love is our child protection services, and Grief Matters, which is our movement to rally community to recognize grief and offer bereavement support, as well as YA, short for Young at Heart, which is a flagship program which aims to promote positive mindset towards aging and older persons. So that's just a breakdown on where I've been for the past 6 years with Montfort Care. So specifically, I've been with Good Life, which is a program that provides good health, or hopes to provide good health, good mind, good family, good friends, good communication, and leading to good living for the senior citizens. So I've been involved with elder care, with the elder care sector within the Montfort Care. Yeah, so we really look into a holistic approach to active aging by organizing various activities and address both the physical and mental wellness of our seniors. So why social work? I found this quote, which I thought was really encapsulated why I chose social work in the first place. And it's really because social workers are people who care about people, who want to make things better, who want to relieve suffering, and who also want their work to make a huge difference. And it's a career of full of meaning and action and diversity and of course satisfaction. And when I mean action, meaning that every day is a different kind of work that you do. So really you are sort of out there doing different things every day. Yeah. So a day in the life of a social worker, we have times where we assess clients' situations and determine what are the needs of what are their needs and what are their goals. We also refer them to correct treatment centers or to different service providers that might be able to help them further. We also have a lot of training to maintain the quality of our work and our standard of the care that we give to the community. Of course, the strong desire to help others is always at the back of our minds and our hearts, and that really helps us to go back to the reasons why we started social work in the first place. So I would say typical workday, a lot of to-do lists. So for example, calling back partners, calling back clients to check in on them, to see how they're doing, a lot of thinking time. I think there's a misconception that we do a lot of work, but we don't have a lot of time to think. But in order to do quality work and in order to bring services to our clients that make a difference in their lives, it requires a lot of thinking time. We do a lot of home visits, hospital visits, community walks. We do a lot of programs at the center as well. It can be active aging programs, it can be exercise, it can be arts and crafts, and so on. And we also do therapeutic group works. For example, we have group works that look into maybe how to manage anger, how to manage caregiver stress, a lot of phone calls, because we have a lot of partners that we work with and we need to talk to them, we need to talk to the hospitals, we need to find out how our clients are doing. And of course, those meetings, case conferences, case notes, and so on. So is there really a typical workday? I wouldn't say so really. I mean, you have your to-do list, you have the things that you want to do for that day, but there's always different things that come your way that make every day different. So what do you need to be a social worker? So I asked my team to what they think a social worker needs, and they all put in their ideas. So a lot of people in my team talked about empathy and compassion, talked about teamwork, talked about reflexivity, and also self-care, patience, some listening skills. I like when somebody put good shoes and healthy diet. Good shoes because I guess we really do a lot of walking and we do a lot of a group and community work. So we're on our feet all the time. A lot of stamina as well. Yeah, but empathy, compassion, and teamwork are the three most characteristics or the three most things that you might need when you venture into a work such as social work. Yeah, so empathy, teamwork makes the dream work. So you're never working on your own. You're always working with other people. You're always working with your own team. You're always working with your clients as well as all the hospitals and all the clinics around you, where you be part of advocating for what your client needs when they are already in the community. A lot of communication skills are really important, both verbal and non-verbal. This is so your clients know that you care for them and they know that you are creating a very safe space, a space that is non-judgmental, where they can be honest and truthful about what they might need. A lot of critical thinking. So things that we hear from our clients or things that we hear from our partners, we need to take them back. We need to think about how this works within the system and within the client system and within the client's available resources. What can we do for them and with them? A lot of active listening. So it's really easy to just hear what somebody has to say, but it's a bit difficult to hear and really absorb this whatever this person is saying at the same time. Reflective and self-care, one of my biggest things that I think that any social worker needs. It's very easy to go back feeling extremely exhausted by all the things that you have to do, by all the emotions that you have to deal with, not just your own emotions, but your clients' emotions and the emotions of your teams. So being reflective about what has affected you on that day and ensuring that you have a self-care routine of your own is so important so that you don't burn out and you don't feel like this job is not for you. Always thinking about why you started in the first place, and also looking at how you can take breaks and ensure that you can care for yourself before you can give care to other people. Cultural competence is also very important. So if we know what kind of culture that we live in, we know how to be respectful and react. So one simple example is taking off our shoes when we go into a client's house. It may be something that we think is common sense, but it really does show, all these little things does show a bit of respect and how we would like to clients to receive. For sure, patience. Sometimes things don't go your way, and clients have very, very bad days, or you yourself have very bad days. So being patient is definitely a characteristic that you have to cultivate when you come into the social work career. Professional commitment as well. There's a lot of responsibilities that you have. So you have to work within your professional commitment, within the ethical bounds that you have. And also advocacy. You're forever advocating for what your client needs. So for example, I'm a community social worker, so we work in the ground. And because I work with the elderly services, we have a lot of referrals from the hospitals and from the polyclinics to ensure that we continue their care within the community. And so sometimes when someone has come out of institutions for some time, you don't really know how to share with nurses and doctors about what they experience in the community. And we can help them to put their words in order so that they can advocate for themselves. And if they can't advocate for themselves, then we can advocate on their behalf so that they get proper care and proper and their needs are properly taken care of. Yeah. So some misconceptions about the discipline. It's all about kindness. As long as you're kind and you're happy and you want to care for everybody, you can be a social worker. Going into social work for the first time, I think this was also something that I thought was true. So I had a mantra of always be kind, but sometimes, most of the time, really, kindness is just something that you can hold at the back of your heart to keep you going, but it's a lot more than just wanting to care for someone. Saikang warrior only, right? So some people think social work is still volunteering, social work is still just doing things for the client with no sort of really intervention or no sort of like goal. But it's not just about Saikang, but it's really about thinking what the client needs and helping them to be self-sustainable so that we no longer need a social worker. So anyone that cares for people can be a social worker. I guess so, but it does take a lot of discipline and a lot of work to learn how to be a social worker. Fourth one, we exist to save people. I think this is really scary as a social worker to think that this is what you should do and the whole point of your job, because the point of the job is not to save people, but the point of the job is to advocate for them and allow them to save themselves, allow them to see their problems or their solutions in another light, and also to look at how they can themselves be their own saviors. If a social worker thinks that they are there to save people, it can be really, this person can experience extreme burnout, because saving people is not something that's easy or even at all always possible. Yeah. The work is about giving advice, telling people what they should do or not do. Well, it's not really about that. We're not there to give advice and tell them that, oh, you should do this, you shouldn't drink any more sweet drinks because you have diabetes, but it's really to understand what kind of difficulties this person has with managing, let's say, their problems, with managing the health issues. So let's say if I'm meeting someone for the first time and the issue that is presented is that this person is not managing their diabetes well, and they don't eat their medications, they don't manage their food intake very well. Although I'm not a nutritionist or I'm not a doctor and I cannot really talk about the diabetes side, what we do is to really understand what kind of challenges they have that is stopping them from really taking control of their health. And that's really a very important part, so that we know what kind of motivations or what kind of barriers that we have and hopefully help motivate them and encourage them to the right direction in a goal that they seem that is feasible for them. Like for example, they know they cannot cut down eating char kway teow, for example, at least once a week. Okay, so let's see what other ways that we can cut down sugar, what other ways that we can improve this person's diet that will be comfortable for them, and then look at how they would be comfortable with making those changes. Yeah, so it's not just about like nagging and telling them you cannot drink sugar, you cannot drink whatever. It's really understanding where they're coming from. So yeah, another misconception would be social workers should learn not to feel anything, so they don't. So feeling is a very important part of being a social worker. If you stop feeling and you stop empathizing with this person and you stop having compassion, you stop then understanding or trying to understand what this person might be going through at this point in time. And you become very directive, you become very task focused in what you need to do with this client. And she or he might feel that you don't understand whatever I'm going through and you're not there to process with me, you're not on my side. So we should not feel anything, but we should learn how to regulate our own emotions, be very reflective and have a lot of self-care routine so that we know how to manage our own emotions when we feel too much. We don't know how to control those things. And lastly, what I've been hearing is that there's no career progression for social workers, really a dead-end volunteering kind of job. Absolutely not true. I think there's a way to progress in their career. You can go through a clinical progression, meaning from a social worker, you can move up to a senior social worker, lead social worker, principal, and master social worker, and so on, in which you take on very, very different roles. You get to supervise other social workers and help them to be better for their clients and the community. Or you can take up a leadership role as well, a manager, program manager, director, and so on, in which you really think about the whole systems and how your social workers within your team and within your organization can impact the community and your clients as well. So there's a lot of opportunities to progress. In Montfort Care itself, there's a lot of opportunities because of the different demographics that we touch on. So if you're interested to join and not looking at being just in elder care or being just in family service centers, Montfort Care offers you a lot of opportunities to grow within the organization if you want to look into other demographics and touch on other presenting issues and other conflicts that you want to work on. Yeah. So what about social workers? One message that I would like to share with everybody would be that social workers do make a whole lot of difference, but it is an entire journey of learning. There's never one day that you don't learn something new. Every day you learn from your clients, every day you learn from yourself, and every day you learn from your team and your supervisors on how to move on with your work, how to create a very safe space, and how to allow people to feel and advocate for them as well. We have ton of trainings that you can do to help improve your competency and also improve your confidence in dealing with people and dealing with different partners and so on. So it's definitely a journey of learning. And I like what Amanda said in her presentation just now, that it can be a really tough journey for sure. Every time you take on something new, I think it's really tough. You really feel like there's a lot of things that you learn and it's very overwhelming. But in social work, there's a lot of support. You're supported by your supervisors, you're supported by your team members. And through that, the toughness goes away and you start to enjoy your work. And so persevere through that and find meaning to your work and always remember why you started in the first place. Yep. That's it. Yeah, thank you so much for being with us. Next, we'd like to invite Ms. Lee Xiao Yun, a senior staff nurse from Untitled General Hospital.
Hello, let me share my screen. Okay, so hello, I'm Xiao Yun. I'm a staff nurse from Untitled General Hospital. I work in the emergency department. So let me begin by telling you why I chose to become a nurse. I grew up in a family that valued compassion and empathy. So these values heavily influenced my decisions in participation of a lot of things. So from early age, I knew that I wanted to join something that aligned with these values. So I was thinking of quite a wide range of careers in education, like teaching, social work, and of course, healthcare. So it was only when I was 18, an incident happened that made me seriously consider nursing. So my ama got into an accident. It wasn't anything too serious, but it was a long recovery process because of her old age. And because of that, I had the opportunity to witness firsthand how nurses work from an acute setting, from like an emergency department to the ward. And eventually when she was discharged into a community, to a rehabilitation center. So I had the opportunity to see how they work from an acute setting to a rehabilitation setting. So the nurses were professional and amazing, but it was just one of the many reasons why I decided to join. So I still remember the day when my ama got into an accident. I was actually just still watching my drama when my uncle called on the phone. So he very calmly told me, ama got into an accident. Can you tell your dad? The details are in WhatsApp. So knowing my ama is a fiercely independent and strong lady. And with how calm my uncle was, I didn't think anything serious happened. So I walked into my dad's room. Then I told my dad, hey, ama got into an accident. So from how I conveyed this information, my dad was obviously shocked. And to see such a big, strong man of authority to suddenly look so small, so afraid, that certainly struck me. So it was only a while later, then I was thinking about this whole incident. Then I realized this is what I want to do. I wanted to console my dad. I wanted to give him accurate information about how my ama is doing, but I wasn't able to do that. So I decided I wanted to be there for people who are at their lowest. Of course, I talked to people, some of them who are nurses back then, and find out what they actually do. So after that, I realized I want to be in an industry that equips me with adequate medical knowledge and have the emotional intelligence to properly convey information and provide treatment and professional care to help people. So this is why I am where I am now. So fast forward to 8 years later, here I am in the emergency department. I do not have a typical workday at the emergency department. So the things that I do each day depends heavily on my assignment for the day, where I'm assigned to in such a huge department. And of course, the conditions of the patients who present themselves at the emergency department. So broadly, these are the few things that I do. So I triage patients. I will talk more about this in a while. Then I also help with investigations of what is happening to a patient. So for example, like drawing blood, setting IV plugs, and sending them for relevant X-ray and scans. And then I administer medications that help alleviate symptoms like painkillers, or if your blood pressure is too high, I give you antihypertensives. I also perform or assist in certain procedures. As part of the emergency department, I am also in the medical emergency response team, also known as MERT for short. So when a medical emergency happens in the hospital that is not in the ward, so the emergency department is activated to send a small group of trained staff to handle. So for example, maybe a member of the public faints at the food court. So we'll carry all our things with a small group of people, nurses and doctors. We'll go over there, then we'll find out what's wrong. And if there's a need, we bring the patient back to our emergency department for more tests. So triaging is an important part of my job. At triage, I decide how serious the condition of the patient is based on his presenting complaint and his past medical history. So I also do simple tests that can give me immediate results, such as checking blood sugar or doing an ECG or an electrocardiograph, which is a simple heart check it can very easily show whether you have some electrolyte imbalances or whether you have a heart attack going on. So these are very simple things that is immediate results, and I can successfully triage them into the correct priority level. So let me continue about priority levels. So patients who are critically ill and require resuscitation are priority level 1, or what we call P1. So in P1, there are a lot of life-saving procedures that are being done. For example, intubation, which is putting a tube to help you breathe when you cannot do so, or putting a chest tube, which is to put a tube into the outer layers of your lungs to help drain out fluids or blood. So my job there is to assist with these procedures, or sometimes be directly involved in performing these procedures. So I also administer a lot of emergency medications here. When the patients are more stable, we will be monitoring them, and then we'll be transferring them to more specialized departments, such as the operating theater or the intensive care unit. Or if they are stable enough to move to a general ward, then we'll move them to a general ward. Sometimes they are stable enough for transfer to P2, which I will be talking about now. So patients who require urgent but not life-threatening conditions are priority level 2. Some of the common ones are like fractures and dislocation. So they require orthopedic procedures to align back their bones. So some of them require more sedation so that they don't feel the pain when we pull the bones. So all of them have to be in P2, where we can monitor them and do the adjustments. So we, as nurses, we help with these procedures. We monitor them and make sure they are stable throughout the entire procedures, because certain sedation may cause a drop in blood pressure, which might be very dangerous. So we also insert a lot of catheters. Urinary catheters are one of the main things that we help insert. And of course, we administer medications that help to alleviate the symptoms. So there's then for P3 are for patients in minor emergency. So we do a lot of wound dressings in P3 for patients with abrasions. Maybe they come in for after a traffic accident, they skid across the entire ground, and they have like a lot of, they don't have anything serious, no broken bones or anything, but they have a lot of abrasions. Those need a lot of wound dressing, and P3 attends to a lot of these cases. Then we also have simple fractures in P3 that don't require sedation. So the bones are not too fractured. So you can just put a cast to make sure that they are immobilized for them to recover and for the bone to heal by themselves. So there's a lot of jobs that we do that overlaps in P2 and P3, like serving medications, wound dressings, and the procedures. So it depends on how the patient presents, and what they present, and their medical history. So if they are older and they might be in danger for more side effects, they will be in P2 rather than in P3. So let me move on to what I believe are essential skills that you require in nursing. So these are skills that I heavily rely on in my everyday work, of course, on top of my clinical and practical skills. I believe a nurse needs to be able to think on your feet. Unexpected situations arise every single day, and you may or may not be familiar with them, but you need to have the composure and of course the clinical skills to manage the problem. And especially in ED, where in emergency department, where so many situations arise just unexpectedly. You can have a heart attack in P3, but the patient presents with just mild jaw pain. There are a lot of patients who present themselves with atypical symptoms, but you still have to monitor. So they might suddenly collapse outside in P3, but you still need to know what to do. So the ability to think on your feet is very important. So secondly, being a team player, I believe that's mentioned by Amanda and Deanne too. So in the emergency department, I don't just work with other nurses. I also work with doctors, radiographers, case managers, porters, and sometimes even the cleaners. So I am a team member who works with many other professionals to try to provide the best possible care and treatment for the patient. So to work in a team, of course, I need to be equipped with communication skills. I need to effectively communicate with my team, which are the doctors and radiographers and every other healthcare professionals, about the needs of the patient. As a nurse, you are a patient advocate. You are the person who's physically closest to the patient. So most of the times you are the first one to know what is going wrong with a patient, or whether they need something, whether they need help with any other thing that another professional might be more suited to provide care for. So you need to bring relevant professionals on board by sounding out that they have such needs. And also effective communication also refers to communicating to your patients and their family. So you need to know how to properly educate your patients and their family about their conditions, or if they are discharged with certain equipment or a back slap, you need to educate them on how to take care before their next appointment, because they will have to care for themselves while they're at home. Then of course, lastly, resilience. I think resilience is key to pursuing an ambition in nursing or any healthcare or any career in the healthcare sector. I still remember my very first intubation case, my first cardiac arrest case, and my first major trauma case. I remember my trembling hands, but I am part of the care team. I cannot just walk away. I cannot just say, no, I'm out, because, I'm scared. So part of being resilient, you have to push through and complete your job. Of course, after that, you might want to talk to someone about how you felt, or maybe a senior about how you could have done better. But at the point in time, you need to know what to do, and you need to do the job that you have to do. So I believe resilience is key. And over a long term, you will face a lot of very difficult situations that might contradict your own beliefs, but you still have to continue on, because you cannot just pull out. You have to do your job. So I would like to take some time to talk about the misconceptions about nursing. So nursing is a very public job. Everybody knows what a nurse is and has a rough idea about what a nurse does. I would like to take this opportunity to clarify certain misconceptions, if there are any, about what nursing is and about what I do as a nurse. So these are comments that I have received over the few years of my work. So let me start off with the first one. I do at times assist doctors for certain procedures, but I also enjoy a fair amount of autonomy in my patient's care. Like I have said earlier, I work in a team. There's a strong sense of partnership in the entire team. So we work hand in hand to come up with the best possible solution for the patient's problem, be it their condition or their discharge procedures. So secondly, nursing is not just about providing service. We do take on the role of professional caretakers, but we are also equipped with a wealth of medical knowledge that is applied on a day-to-day basis. So at the back of our head, we know what the symptoms are, we know how they relate, and we know the indications of medications, and we also know about treatment plans for the various conditions. Our judgment and to make calls and to give suggestions to the team whenever there is a need to. So lastly, nursing is not always exciting and action-packed like what you see in medical dramas, and like the two photos that I've inserted here. These are photos that I took off the ground. So these scenarios definitely do happen. But there are also days that are a bit more routine that you need to get work done and you have to clear your tasks. So some advice that I might have for people who are interested in joining the healthcare sector, talk to your family and a nurse who knows you, so you can get more honest views of whether you suit this industry. And also, if you want to join this, be prepared for a journey of lifelong learning, as mentioned earlier just now. So clinically, research is always being done and new equipment are always being invented. So there are always better ways to do things. Over just a course of few years, I have to learn and relearn things already. So if you are joining us in the healthcare sectors, be prepared for lifelong learning. And also soft skills wise, you will also learn to communicate with different people, be it patient or other professionals. You'll come across so many different people. Learning how to work with them is also a skill that is continually evolving and you will need to develop as you progress in this career. That's all. Thank you for your time. I hope to see you in the near future. Thank you.
Hello, hi. Thank you, Xiaoyun. Okay, hope everyone can see my screen. Right, good morning to everyone. My name is Vivian. I'm very honored to be sharing today about my role as a pharmacist. So just a little bit about myself. I'm a healthcare merit award scholar from the year 2015, and I studied pharmacy in NUS. I graduated in 2019 with Bachelor with Honours, and since then, I've been working with Woodlands Health as a registered pharmacist. I think that among our listeners today, there might be at least a few of you who are interested in pursuing a career in pharmacy. It could be you who is listening. So hopefully this could give you some insights. So let's dive right into it. Right, firstly, why did I choose pharmacy? So healthcare has always been an interesting career choice to me. As you might already know, Singapore's public healthcare and community care sector is currently a sunrise industry and with a lot of room for contribution. I wanted to be part of this growing community of like-minded professionals who are dedicated to providing quality healthcare to all who need it. And the typical pharmacy today is no longer only a place that dispenses medications. We are now more involved than ever in having direct impact in influencing this disease management. So this not only includes the chronic diseases such as your high blood pressure, diabetes, and high blood cholesterol, which are the more prevalent chronic diseases, but also the acute ailments that are considered minor enough for self-treatment by patients, such as your common cold, cough, and pain, mild symptoms. So currently I work as an inpatient pharmacist. This means that we take care of the medication needs of a patient who is warded and receiving hospitalized care. I typically begin my day by conducting medication reconciliation or MedRecon in short. This is the act of putting together a complete and accurate list of all the medications that a patient is taking. And while this can actually sound simple, at times it could be a difficult task, especially if the patient visits multiple disciplines and institutions for follow-ups, or if they have their medications titrated by private practitioners, such as their GPs. And following that, I joined the team in the morning ward rounds. This is where the team may discuss how to adjust the management. And as a pharmacist, at that point, I may be able to voice any input I have about how to optimize the medication therapy so that the patient may receive better and more appropriate care. And then afterwards, for the most part of the day, I will review the active inpatient medications of all the warded patients. So currently a ward typically has about 35 patients, and it depends. Sometimes you may be scheduled to be allocated to one ward, sometimes maybe 1.5 wards. Yeah, and this medication review step is crucial in identifying any potential inappropriate use of medications, and it should be a constant process. For example, an acutely ill patient could have rapidly declining kidney function, and this would warrant appropriate adjustments in the dosages of medications that he or she is receiving in order to prevent any toxicity that's due to buildup of medication in the body from not being able to clear them in the urine. Another example is where, while hospitalized, a patient may have new diagnosis of medical conditions, and so the patient will be started on new treatments for them. In this case, it is also our job as pharmacists to screen these new medications against the old medications that the patient is already taking. And by doing that, we will ensure that there will be no drug-drug interactions, which could lead to adverse effects that are being experienced by the patient. If any potential interactions are discovered, we will actually speak to the primary team about these concerns, and we will suggest any alternative medications that could both treat the newly diagnosed condition, and yet at the same time, we avoid having all those unwanted adverse effects. And finally, at the last stage of a patient's stay in the hospital, when they have actually recovered and are well enough to be discharged, a doctor will write a prescription. This prescription is processed by a pharmacy. So the pharmacist will first check through this entire list of medications and ensure that all the doses and other parameters are appropriate and approve it. The pharmacy team will then prepare the medications, and at the final step, the pharmacist will also check through the physical medications that are packed. We may also be involved in dispensing the medications at the dispensing counter in pharmacy, and we will be counseling the patient on how to take their medications, what side effects to watch out for, how to manage them if they experience any such side effects. So you can actually see that the inpatient pharmacist is actually very involved in every step of the patient's hospital stay, from the very beginning when they are admitted to the very last moment when they are discharged. And besides the typical activities of a ward pharmacist that I just described, pharmacists can also run specialized services. And this is a list on the screen that you can see. This is a list of some services that are run by pharmacists, and they actually require special training and knowledge. So I do actually feel that we pharmacists are actually quite amazing people. Yeah. Okay, so moving on, you may feel, if you feel that you want to play a part and you're interested in becoming a pharmacist, then what are some skills you should be equipped with? I think firstly, as with all healthcare professionals, I would say one of the most important skills is to actively listen to your patients and have the empathy and that human touch. These will ensure that healthcare is actually not so easily replaced by AI. And our patients nowadays are also more empowered to make decisions that impact the management of their own conditions. So we need to be able to work alongside them together with their caregivers and their other multidisciplinary healthcare professionals in providing that holistic care for the patient, and so that the patient may be able to be empowered to manage their own condition as well and have a say in their treatment. Pharmacists also have a lot to contribute in educating patients about the correct use of their medications and in correcting some of the misconceptions that patients have. And lastly, it is also true that we have to memorize quite a lot of information relating to medication doses, drug and drug-food interactions, monitoring parameters, etc. Having all this knowledge at the back of our minds actually ensures we can apply them very quickly when we are reviewing medications. And we are also a walking drug reference in a way, not only to our very inquisitive patients who have many questions about their medications, but also to other healthcare professionals. I think doctors very often look for pharmacists to check on or for suggestions of appropriate medication doses. And nursing, we also work very closely with our nursing colleagues. I think Xiao Yun will agree with this. Nurses may consult pharmacists about when to schedule the administration of a medication, whether it's before food, after food, maybe how to reconstitute or dilute and administer some of the intravenous antibiotics. And of course, conversely, pharmacists also appreciate help from our nursing colleagues in various ways as well. For example, in ensuring that timely blood draws can be taken, which is absolutely important for accurate levels of drug in the body, in the blood to be taken, and so that pharmacists can actually use this information to calculate how much to give in the next dose and when to do so. However, that said, while it seems like we have an overwhelming amount of knowledge that we need to pick up as a pharmacist, I think you do not have to be afraid that you do not know every single thing, because when in doubt, many of us still do check up our drug references, and that is actually okay. So moving on to some common misconceptions about pharmacy that even maybe a small number among our listeners today might also have. For example, some people say pharmacists only give out medications. So this is incorrect. As I mentioned previously, we are heavily involved in many steps in the care of a patient. However, I think at the final step at the dispensing counter is actually quite typically what is visible to the general public. And so perhaps that is the reason why there might be this misconception. But of course, we do a lot more than just dispensing medications. All right, and then pharmacists just supply whatever is on the prescription. This is also incorrect. As mentioned, we do very thorough checks to ensure the prescribed medications are actually suitable for our patients. If we actually find any potential drug-related problems, any interactions between medications, we will actively intervene with the prescriber instead of just simply processing the prescription as it is. In a way, pharmacists are actually the guardians of medication use, and we prevent actually many potential medication errors from reaching the patient. And now some people say, oh, pharmacy only sells cough and cold medications. So for all my other medical problems, I must go either to my GP or to A&E. And I think many of us actually walk into a retail pharmacy to buy typically cough, cold medications, maybe pain medications like Panadol. In fact, actually pharmacies also offer medications that target a number of other minor ailments. For example, medications for gastric discomfort or acid reflux. Many times by speaking to the pharmacist, you can actually obtain more information and be guided to the most appropriate medications for your minor condition. On the converse side, if your condition is considered too severe for self-treatment, the pharmacist will also be able to advise you on how and where to seek appropriate medical treatment. Okay, and lastly, the saying, some people do say maybe pharmacists are not as important in the healthcare sector. So no, this is also a misconception. And I believe that every role in a multidisciplinary team has its role to play in ensuring holistic care for a patient, and each one is just as important. So we actually have many different duties, as I shared with you previously about what a pharmacist does when we are actually managing a patient together with our other healthcare professionals. Okay, finally, I want to give some words of encouragement to any of our aspiring pharmacists out there who are listening to us right now. I think that pharmacists actually bridge the gap between patients and physicians. We actually uncover a lot of non-compliance to medications, and these can be reasons, for example, inconvenience of medication timing. For example, some medications need to be taken 3 times a day, and patients may actually forget the afternoon dose when they're outside, when they're working, etc. Or they may actually be experiencing side effects, so they choose not to take the medication. Actually, these are not good for their disease control. And so when we speak to patients and when we discover these reasons, we can actually help to discuss with the physicians how to optimize their medication therapy, which will help patients to simplify their medication regimens. And in turn, it makes it easier for them to actually manage their own conditions and be compliant to their medication. Besides that, as alluded to previously, pharmacists are also increasingly involved in running specialized services. So there is always room to contribute more, and our role is increasingly important in providing optimal healthcare. And lastly, a career in healthcare, or I'll say even in healthcare, a career in pharmacy or even in healthcare in general is definitely fulfilling. You'll be able to explore diverse pathways to fulfill your aspirations, and there'll be exciting career and professional opportunities that are waiting for you ahead. So with that, hopefully you feel more inspired by now to join us in the healthcare sector. And even if you don't, I hope that I have provided a good insight into what a pharmacist does. And hopefully you walked away today with new information and renewed confidence in your interest in healthcare. And with that, I thank you for your time. Thank you.
Yeah, thank you very much to our speakers for your sharing. I would like to now invite all the speakers to join me for the Q&A. So speakers, you can turn on your camera and audio. Okay, hold on while I retrieve the questions. Okay, so we do have many questions centering around mental health and physical health. I think because of the pandemic, that's only understandable that we are all wondering how do our healthcare professionals cope. So the first question is for Diane. The question is, does being a social worker demand strong mental health and physical health in the sense that you are always hearing and helping others continuously that could wear you out mentally? Would you think that staying in this occupation could make you feel tired gradually?
Yeah, thank you, Nigel, and thank you for that question. I think it really speaks volumes to self-care and reflexivity. I think we mentioned during the presentation. So for any profession, really, the possibility of burnout is there. And for social workers, I think you're right. We do see a lot of people. We hear a lot of people who have some maybe not so good days. And so we're there absorbing, sort of listening to all these things. So for sure, I think we have to be very wary of how this affects us. And that's why being reflexive about these experiences and how this experience affects us personally is very important. So one thing that helps is really the teamwork that you have. I think I depend a lot on my supervisor as well to ensure that I'm not too affected, or why am I affected by a certain problem or an issue that happens. And in this case, we process with our supervisor and our team to ensure that the work that we do later on is not affected by this sort of continuously hearing people's issues and problems. Yeah, I think wearing out mentally really speaks to burnout, and it's really good to also identify signs of burnout, right? Like not really wanting to go back to work, really not enjoying the day anymore. Every little thing seems like a burden, and you're just extremely tired and exhausted. So these are signs that you can look out for in any profession, really, to help you notice that, oh, okay, question yourself whether you're experiencing any burnout. Yeah, so staying in this occupation, in any occupation, really, you can feel tired gradually, but really that being able to reflect on what does burnout feel to you, and take some time away from the work and don't bring home work, go out with your friends and family and really talk about it, would help you not feel tired too much. Yeah.
Thank you,
I hope I
Diane,
answered the question. Yeah.
Yes, I think you have. And I guess to add on, right, I'm a working professional myself, and burnout or mental challenges, health challenges do happen in every profession, especially now in the pandemic, right? The frontline workers are facing this situation. So about of you are A-level students, poly students, uni students. I think when you go out to work in the workforce, right, there is that challenge of adapting to that work. Suddenly you're not a student, suddenly you have no more holidays. You do have to work a certain amount of hours a day or a week, and you have to clock in your salary, right? Because you need to pay things like your rent, your education fees, and so on. So I guess the tips here, or rather Diane shared, right, is they are very real. So things like going out with your friends, chilling out, these are things that you still need to do. And when you find that you don't have time to do such things, you find that you are behaving out of sorts. For me, it's drinking more coffee than usual, like way too much. Do stop, have like a place where you can reflect, you can adjust, try to change what is going on. Like if you're feeling very stressed about something, take a break, get a colleague to take over, talk to your supervisor, things like that. So there are various ways to address these sort of issues.
Yeah.
So
yeah, maybe I actually can just add on, Nigel. I think all of us health professions, maybe we don't want to admit that we burn out, because we are in this profession where we feel like, okay, we need to be there for our patients and our clients. But I think in order for it to be normalized and to not be ashamed of it, burnout is very real. So don't be afraid of talking to your supervisor about, okay, I'm not really having a good day, it's been a really difficult week, and be honest and true with people who you trust, so that you can demolish this idea that, oh, burnout is something that happens to like weaker people. It really happens to everybody at any point in time in your career. So don't worry about talking about it whenever you feel like it. Yeah.
Right. Thank you, Deanne. Let's move on to our next question. So the next question is for our nurse, Li Xiaoyun. So we talked about mental challenges and burnout just now, right? And the question we have here is, I am considering to be a nurse, but I am daunted by stories on how difficult and taxing it is, abuse, anxiety, mental and physical toil, health issues arising. How will you encourage or advise someone who is considering this career path?
These problems are very real. I am indeed facing some of them right now because of the pandemic. And for myself, I do a lot of self-care. I talk to people. I cry quite often. I'm not ashamed to say it. I think it's the way I release my emotions, especially after a very, very difficult day at work. I'm not afraid to talk about that either. So what I do is I talk to people, I cry, I let it out. I also exercise a lot. I do things that make me feel me. Yeah, so sports is something that I've always pursued since young. I've done sports like all my life. So this is what I'm still doing and I still like to do. And because I do this sports with friends, so I get to hang out with my friends and I get to do the things that I like at the same time. So I feel like this helps me release all this stress quite effectively. So if I have any advice for someone who is considering this career, make sure you have a steady support from either your friends or your family, because these are people you want to hold on to when things are tough. You might also be able to find them among your colleagues. I talk to my colleagues very often. We rant and we whine about things. We complain a lot about things lah. Yeah. So that's how I cope. So maybe you have a different coping strategy. But at the end of everything, I want to say, find things that make you happy and continue to do them no matter how tired you are, because these are really important things that make you feel you. Yeah.
Thank you, Karine, for sharing. Yeah.
Do I move on to the next question?
Okay, let me look at what is the next question for you. Okay, we have one here, right? Which is more towards the nursing profession, the specialization. So the question is, do all nurses start out at bedside nursing, or can you immediately enter emergency nursing upon graduation?
Most nurses start out at bedside nursing because that's where the bulk of patients are. So when you have more patients who need that kind of nursing, you have more nurses who are required at bedside nursing. But for me, because when I joined, there was like slots in emergency nursing when I graduated. So fortunately, I was able to get into emergency nursing. But I guess it depends on the hospital that you want to apply to. Yeah.
Yeah, okay, thank you. So to add on to Xiaowin's answer, right? For nursing, many of the nurses, after they study, they do go on to do general nursing and really get the basics of nursing right. So you do have to do this in your early years as a staff nurse or a senior staff nurse, right? As you really pick up the traits of the tools of the trade. Then I think what happens is then depending on your interests, or what you're good at, you can pick up the different specializations of nursing. So you'll be sent for courses, you'll be trained, you'll be given on-job training to do these specializations. It's a very long list of specializations. You can go on to the Care to Go Beyond website to look at these specializations. I'm pretty sure there is something in there for everybody. So if you like the fast-paced setting, you can be like Xiaowin and do the emergency nursing. Okay, let's move on to a question for Amanda for DR. So diagnostic radiography, what are some common challenges faced in this line of work?
Okay, all right. I thought of 2 or 3. So the first one I would say is that because when patients come to us in the emergency setting, especially, and they're in so much pain, we don't know where the pain is. And radiographers are the first person, to eventually find out if they really have a broken bone somewhere. So when we have to take those diagnostic images for them, they are sometimes screaming in pain. So a lot of it is about managing their pain tolerance, and just constantly reassuring them, that you're doing a good job, you're getting into this position for me. We are almost done, hang in there. So I find that sometimes, when patients are in a lot of pain, they're not going to want to listen to anything you say. So you really have to manage that conversation well with them. Additionally, I would think the next challenge would be the radiation awareness. Sometimes the doctors are so focused, on finding out the issue that's causing this patient a lot of pain, but they've forgotten about the radiation dose that the patient might receive from, requesting for so many scans. So then I would be able to give alternative suggestions to reduce the amount of radiation dose that the patient gets, and also making sure, that the patient gets the proper diagnosis. And lastly, like what Sharon has also mentioned about burnout, I think also as radiographers, we do see some of the more gory things, and it can be quite emotionally scarring for us. So it really is about compartmentalizing, and as Sharon mentioned also, just doing what you love. Like for me, my hobby is photography, so I'll spend my day off going out to take photos, for example, just to be away from work, basically leave work at work. So yeah, that's my sharing for common challenges.
Thank you, Amanda. Another question for you: what is the career progression like for a radiographer? Are the specializations like clinician, education, research available?
Okay, all right. So this is a two-part question. I'll answer the first part. Career progression as a radiographer, there's tons of opportunities. So I mentioned before, everyone starts off with doing general X-ray. So that's our foundation. And then as you get more senior, you will go on to like you get to branch out. So either you choose CT scan, MRI, or ultrasound. They're a bit more advanced in technique, and the scans are longer. So you really have to learn the tricks of the trade first. So that's how you can progress up as well. On top of that, there are different, I think, I can't remember what the term is called, but they're like codes. Maybe Nigel, you can help me out with this. So I'm an AH12, and then you can go to like AH 13, 14. So basically what that means is that I start off just doing clinical work, but as I progress further as well, I can choose from 4 different areas to specialize in, one being administrative work, clinical work, specializing in education or research as well. So for me, I'm sort of going towards the education path. I'm also a lecturer at my alma mater, Monash University, and I'm also a clinical educator, taking in the radiography students that come on clinical placement as well. But yeah, so there are tons of opportunities for growth in this career, I would say.
Yeah, thank you, Amanda. So I guess I see all the professionals nodding their heads when you talk about the tracks, and I do think we go to the hospital all the time, right? Be to see someone, to see anybody, and you always see the person there. You see your doctor, you see your nurse, and they are all doing clinical work. But what people usually don't realize is that the AHP careers and the nursing careers now do have a lot of structure in place. Like Amanda mentioned, right, there is the education track, there is the research track. If you want to deepen your clinical skills, you can go deeper into the clinical track. And it's the same for all the HP disciplines and the nursing discipline as well. There are so many options, right? And I think I saw just now in one of the questions in our event feed, right, saying how do you upskill nurses these days? There are so many examples and policies to do this. I can't really print out a whole list, but generally these days, right, compared to in the past where I'm in my 30s, right? Then last time when I was a diploma student, nursing was always, it was the reality back then. It was always the course of last choice for many of us, simply because of the stigma, simply because of the points weren't very high. If you didn't do very well, you could still go into nursing, that kind of stigma. But that has changed. That was like 10, 20 years ago, when I guess the healthcare system was still ramping up. We were building up certain capabilities and so on. These days, it's very different. The peers, my secondary school friends that I still hang out with, all of them are doing very well in their nursing careers. So some of them have went on for further studies, taken their masters. One even appeared in the news a few years ago as an APN. But anyway, my point is that you can go and check out the pathways. It's posted on our website, the Care to Go Beyond website. Check them out depending on your own interest as well. Amanda is going to the education field. You can then venture out as a HP or as a nurse. So it's very different situation these days. Okay, we have some questions for Vivian. So the question is, for a pharmacy degree, are there other career options, progression pathways other than hospital or retail pharmacies? I'm interested in pharmacy, but some people have advised me against doing so as very specific, less flexible, and there is limited career progression.
Right, thank you for the question. I think for me personally, the hospital pharmacist kind of track has been slightly closer to me, because when I studied pharmacy in NUS, and then afterwards I actually had a period of attachment. It was at a polyclinic, so it was still very much of a similar to frontline kind of a pharmacist role. But I do recognize that, other than hospital and retail pharmacists, there could be people who are interested in looking at different types of roles outside of these for pharmacists. So maybe I can share, for example, there could be people working as pharmacists in the regulatory industry. So essentially, these are people who assist in preparing like new drug applications that, for example, certain new medications are being brought into Singapore and being approved. And these pharmacists actually have an important role in safeguarding the importation and registering of new medications and medical devices. So regulatory pharmacies is one aspect. And there are also pharmacists who go into the research field, for example. And these are experts that they actually work on finding different types of cures, or looking at medication, for example, new formulations of medications that can ensure the same type of therapeutic effect, but with fewer side effects for the patients. So they are involved in conducting clinical trials and studying the effectiveness and safety of new medications and all that. And then perhaps one more that I can add on is we have academic pharmacists as well. These are people who impart their knowledge and they actually educate future generation of pharmacists. They are the lecturers and the tutors, and they may also sometimes engage in some kind of research activities. So if that's what you are into, then actually this is a possible path you can consider. Yeah, and I think finally, I'd just like to say all this actually, like regarding different pathways that a pharmacist can take, you can actually find out more information. We have this PSS website, so it stands for Pharmaceutical Society of Singapore. You can go onto this website. There's actually this page that explains the many phases of pharmacists, and you can try to explore which pathway is actually more suitable, you are more interested in, can be more catered to you if you're interested. Yeah.
Thank you, Vivian. We have a quick question, which is, does your chemistry need to be super good to become a pharmacist?
Okay, yeah. So yes, this question, interesting question. Yeah. I think that actually chemistry knowledge is it gives you a good basis, because most of our medications, you will start off learning the medications from their chemical structure actually, and so you'll know how they actually exert their effects in the human body. But I would say that it's not one and all to everything. And in my 4 years of pharmacy school, essentially you kind of just learn that basics in the first year, mostly in the first and second year. And then you will have additional things to learn as well. If you don't have biology background, they will tell you you will need to learn a lot about human biology, etc. And then afterwards, after all this foundation is set in place, you will move on to learn additional things, anatomy, physiology, and specific therapeutics. So I would say chemistry is a one part of it, but it's not everything. And I think even if you are struggling kind of with chemistry initially, I think you don't have to be afraid. Eventually, if you worked on it, and there are other things to study about as well, I think that it's not a hard stop to a career in pharmacy. I think there's still a bright future ahead if you want to. Thank you.
Thank you, Vivian. So it's 11:26. We'll have our last question. So the last question is about how can pharmacists remain relevant and prevent being replaced by technology? This is a very real question, and I think it has been popping up in recent years. I would like to also open up to the panel, right? If you have any thoughts on this, you can add on as well. So how can healthcare professionals remain relevant? Is it true that you're being replaced by technology? Yeah, please feel free to answer.
Okay, I think I'll just start off by giving just a short comment so that my other colleagues can actually have their say. I think for pharmacy perspective, I think in the pharmacies itself, technology has been increasing their role in the sense of helping to reduce that manual labor that we do, for example, in the picking and packing of medications. So nowadays there are machines that actually scan barcodes so that the right medication, it just falls into that basket of all the other medications that's on the prescription. But I think the counseling of medications part, during that dispensing, it still requires a lot of human touch and being able to explain to patients in a way that is understandable by them. So, and sometimes we have to use different languages, different dialects, and even, the way that we speak to them also when explaining the how to take their medications and stuff. It's still very much human, I would say. I do not foresee that this part can actually be easily replaced by technology. Although the technology part can help in reducing our workload in these certain other areas so that we can actually ensure more focused care in that patient front kind of setting. Yeah.
Yeah, the rest, do you want to add on?
Can I add on? I actually call my pharmacist quite a lot to ask them about medications, especially with all the COVID pandemic, right? There are a lot of new medications, and sometimes I'm unsure about either dilution or indications or the schedule of the medications. Then I'll just call them. I'll just ask them. I don't think that can be replaced by technology. Yeah. So thank you, pharmacists.
And we thank our nursing colleagues as well.
Yeah, how about Amanda and Deanne?
Yeah, similar here. I cannot imagine not being able to talk to someone at the hospital. So even despite being in the community, and maybe we work a bit differently from medical social workers who work on inpatient and outpatient, but in the community to help patients and clients or elderly continue that care, right? We contact the hospital quite regularly. We have regular NDM. So I cannot imagine if all these things are replaced with robots, because it's a very human work, right? We are so connected to people and who they are and how things can help them. So even it would be very weird to talk to a robot about how the patient is doing and whether this person is eating her medications well or not. Yeah, and so for social workers also, I did a little Google. It's one of the lowest chance of being replaced by robots. So you can go and Google if your job can be replaced by robots. So social workers are one of the ones that will probably never be replaced by robots. Also because of the real nature of the work. We really need to understand, we need to connect with people. So yeah. So the job is safe. Yes, definitely.
Thank you, Deanne.
Okay, so I'd like to add, I think that in jobs that require compassion and empathy, it's very hard to be replaced. As a radiographer, yes, there are tons of equipments coming out there in the market where patients pretty much just lie on the table and the voice tells them to breathe in, breathe out, and the scanning happens very in an automated way. But at the end of the day, the human body is actually, there's a lot of anatomical variance. So it requires a radiographer or a human then to come in and recognize those differences and then tailor our imaging so that it will suit that particular patient as well. And on top of that, if the patient was in pain, research has shown that what they would yearn most for in those moments is really a compassionate voice or a caring hand to care for them, and not like some artificial intelligence coming in to just continue the scan. That would be quite cruel, I would say.
Thank you, Amanda. Yes, I agree. So I had an X-ray like 2 years ago, and I can tell if it was a robot, I will feel freaked out because I don't know if it's a guy thing lah. Probably is because I did the body X-ray, right? Then you need to wear the skirt and so on. Then I was like, whoa, what's this? I feel quite vulnerable lah. So the radiographer came in and was like, oh, you can just position here very quickly. You'll be over. Don't need to be worried. Then you sort of calm down because
there's the reassurance
before, so
yeah,
I mean it's just that human touch lah, which is very, very underrated. But once you are in that position, right, it really makes a difference to you. Yeah. So I do think your point is super relevant. Okay, it's 10:33. We have overrun, so we'll be ending the Q&A. Once again, we would like to thank the speakers for their time. We really appreciate it as they are currently fighting the pandemic, but they have taken the time off to share with us. So thank you very much, speakers. You may take your leave now.
Thank you.
Thank you.
Thank you.
Okay, we have come to the end of our session. I would like to remind everyone that a simple session survey will be launched right after this. We'll be picking 3 survey participants to win a GrabFood voucher each. Do have a good lunch and come back later at 1:30 p.m. For the next session where our healthcare scholars will be sharing with us. So the scholars are in university now. I think if you want the scoops on university life and the tips, you'll be able to hear from them. Yeah, thank you and bye-bye.